to another edition of Pulse on Health. I'm your host, Mark LeMay. Natural remedies haven't been on the typical radar screen for physicians to prescribe to patients, but they're becoming more and more prevalent through the years. Here to talk this week about natural remedies, Dr. Lance Braye, fourth-year resident at the Lawrence Family Medicine Residency program here at GLFHC. Welcome to the program, Doc.
Thanks for having me on, Mark. I'm glad to be here.
The definition of naturopathy is natural cure, and there are actually naturopaths that work with family physicians on a whole host of issues, correct?
Yeah, there are, but unfortunately, that teamwork isn't necessarily automatic. So if you're seeing a naturopath or a natural doctor, whatever you would like to call it, you definitely should let your family doctor know so that then we can start working together. Because unfortunately, it's not like we send emails automatically.
Do family medicine docs can they act as a natural doctor?
Yeah, definitely. So a lot of times, when we talk about naturopaths or what some patients tend to call natural doctors, that it's not so much that they went to medical school just like we did. It's that this is someone who specializes specifically in herbal remedies and things like that. But what I always have to explain to patients is that there's a couple different layers to how the government treats all these things. So, for example, turmeric, right? It's a spice that a lot of people tend to use. It has anti-inflammatory properties. A naturopath will give you turmeric capsules probably if you come and saying, "Oh, I've got some bad knee pain." But then similarly, my patients that come in with knee pain, if they're interested, I say, "Hey, you could also just take turmeric and see how that works for you." So we both, myself and the naturopath, will like prescribe or suggest these things.
Mhm.
But the difference comes in that the naturopath, like that's kind of their thing. And when the turmeric doesn't work, they're not going to say, "Well, have you tried diclofenac?" Whereas me, if the turmeric doesn't work, I'm like, "Okay, well, we have ibuprofen, we have diclofenac, physical therapy, all these different things." Similarly, every pill, prescription, drug that I give you, that's been vetted by the Food and Drug Administration to say this is safe, this is effective. We are okay with doctors giving these to patients all across the country. Whereas when it comes to herbal remedies, although, they are natural and safe, that's not really regulated the same way. So I can always guarantee you, if I give you a 200 milligram tablet of ibuprofen, there are 200 milligrams of ibuprofen in there.
Yeah.
But if I say, here's a turmeric capsule, I can't really say that it has the same dose in each thing. And, and depending if the company that put that capsule together is, playing by the rules and trying to do right by people, we also can't guarantee that's turmeric in there. So that's also the other caveat I give people that folks don't tend to realize.
Why are natural remedies becoming more and more popular among doctors?
Yeah, that's a great question. So every day, in medicine, you're always learning. We're learning more and more. And some of the things that we're learning is showing that natural remedies, especially things like eating a healthy, balanced diet and exercising regularly, that they work. We also know that these are treatments that patients want. So we're trying to do more studies to see if certain herbs and plants are better than some medicines. And honestly, a good number of the medicines we use get their origins in the fact that somebody years and years and years ago was like, I noticed if we use this plant, that this thing happens. And then eventually, once we had laboratories, we were able to isolate it. Like one of my favorite things that's native to South Carolina, which is where I grew up and where I did medical school, is we have this plant that grows on the beach that's called the toothache tree. And that's because the Native Americans that lived in the area, the colonists had noted that they would use the leaves of this plant for pain relief. And if you pop off a leaf from the toothache tree and you chew it, your mouth gets numb as if you were using a little bit of Orajel. So, probably the reason that we have Orajel is because people were like, the Native Americans, they use this leaf. Well, what is it in the leaf that makes your mouth numb? Okay, now let's make that in a lab, times it by 10, and put it in a cream, and boom, now you have Orajel. And actually, a lot of our common diseases like diabetes, high blood pressure, we know that they can be improved when you focus on natural treatments. But these natural treatments are things like eating a lot of fruits and vegetables, because those have fiber, nutrients, and anti-inflammatory properties that you want, and avoiding sugary foods. So a lot of people tend to forget that a healthy diet is a natural remedy in itself. Then also herbs like ginger, garlic, turmeric, like I mentioned before, they're also anti-inflammatory and can help too.
Natural remedies are being prescribed, and I use the air quotes,
Yeah.
for common ailments and not major issues, like let's say a cardiac issue, correct?
Yeah. So trying to think of how to put this in the best way.
Well, other
Really what
than
it,
the fact that healthy eating, which you just brought up,
yes.
healthy eating will help prevent cardiac issues. Healthy eating can assist with, bones, aches, pains, what have you. I'm talking about, major issues.
Yeah, yeah, definitely. So to answer that question, what I want to kind of clarify first is there's different levels to when we're talking about treatment, right? The first level is prevention. If I can get you to never smoke a cigarette a day in your life, I can more than likely prevent you from getting lung cancer, right? But then let's say you're already smoking, and then we check your lungs and we find out there's cancer. Now we're kind of at that first level of treatment where, okay, we have to get this cancer out. And then it goes on and on, like because you had the cancer, then you had this other thing. So now I'm treating that. And then like the list continues. So when we're talking about natural remedies being prescribed, but not major issues, you kind of have to think of those again. Like you've already said, healthy diet and exercise, that's going to prevent things. For example, we know if you can eat a whole food plant-based diet, or like I always tell my patients, more vegetables and fruit, more fruits and vegetables than meat, then you can actually prevent heart disease in the future. And there's been studies that have shown you might even be able to reverse blockages in your arteries if you can do that. But that doesn't come up to the same level as a definite treatment, like a surgeon, cleaning out your arteries for you. So the way I like to explain it sometimes as well is, if me and you got in a time machine right now, Mark, right? And we go back 10,000 years, humans are still around, but I'm not really a doctor like we call it today. I'm more of like a tribal medicine man. And I'm giving you plants and I'm giving you all these things that will help you, like that toothache tree that I was talking about. But the
Mhm.
problem is if you came up and you were having a heart attack or a stroke 10,000 years ago and you're like, medicine man, give me something. I was just like, um,
You're out of
it's been
luck.
real. Yeah. Whereas nowadays, when you're having a stroke or you're having a heart attack, you go to the emergency room. We can test your heart. We can do scans of your brain, and then we can take you into surgery or give you these powerful medicines that will fix it right there in the moment. But for people who can't necessarily get those things because they might be too sick, or they just, again, want to prevent, because prevention is always best. If they want to prevent those things, just eat healthy, do those natural remedies.
And as with any situation, we sort of have to put the disclaimer out there. An individual should talk to their own physician about their own specific healthcare issues and needs before embarking on any sort of change in your health habits.
Yes. As a family doctor, the way I see my job is I'm not here to say you should do this, don't do that. Honestly, I'm just a health advisor and a coach. So, if you're into sports like I am, you got to think about this. Would it be okay for the Patriots to go out there and change the play without telling Coach Belichick? I don't think that'll go well in the locker room, right? So
Right.
it's the same thing. If you have a family doctor and you want to change up the plan for what you're going to do to protect your health, let us know because it's hard for us to help you if we don't know what's going on.
Well, and wouldn't that open up the conversation? So, for example, I'm a patient of yours, and I read that X can do this for Y symptom. And I come to you and say, hey, doc, I read, this does this for this. Does that open the conversation to say, hey, maybe you might be interested in more natural remedies or alternative medicine?
Yeah, honestly, I get into that situation all the time with my patients. I could think of a couple right now that I know they always prefer to do things in a more natural, non-pharmaceutical way because we've had conversations like that, like we're talking about it's just like a general physical and we're talking about their risk for diabetes. And, I get into the usual spiel about like, hey, your blood sugar is a little high today. It's not necessarily diabetes, but let's talk about a diet that you can eat to help control your blood sugar and keep you from getting diabetes. Or let's talk about what kind of activities do you like to do? And then maybe if we do that 3 times a week for about an hour, we can also help with this. And then they might bring up like, okay, I hear you, doc, but I heard apple cider vinegar, for example, like might help with my blood sugar. And then that's kind of my signal to be like, okay, we're gonna do this. And then we're gonna talk about like all the other different great things out there that are natural, that you can get from the store or grow in your backyard, honestly, or on your rooftop, wherever your garden is. Mine sits
Hmm.
in my office at home. And how you can use those to really help your health.
And again, conversation with your healthcare provider is huge.
Exactly. Exactly.
What is a probiotic?
Yeah. So a probiotic, whenever we're about to dive into probiotics, I always want to take a step back and just get it out of the way. Right now, Mark, you and I are covered in billions and billions of bacteria, right? Some people don't know that,
Yeah,
but
that
you
made me a
are.
little squeamish, but okay,
Yeah,
sure.
yeah. That's why I always just get that out of the way. So you can't see it because that's why we have microscopes. But right now, we're literally crawling in bacteria. But a lot of those bacteria are doing a good job for us. They're helping protect our skin. Whatever you had for lunch, whatever I had for lunch, there's bacteria in our GI tract right now that's helping break that food down. So they do a good job. It's like we're like a giant living ecosystem when it comes to bacteria. But what happens when we get sick, because usually when people hear bacteria, the reason you got squeamish is, well, when there's bacteria, that means there's like an infection and stuff. And that's kind of more when things get out of balance, or if, one of the bad guy bacteria kind of moved into the neighborhood and took everything over. So probiotics kind of help keep that balance. A probiotic, a lot of times, when you're getting it in the CVS or the Walgreens, for example, is a pill, it's a powder, or some form, in a bunch of different yogurts have them too, that has a lot of the good bacteria. That the idea is that it helps with the balance of bacteria to help with your digestion, to help you keep you from getting sick. But since we're talking about natural stuff, there's also much more natural ways to find probiotics. You don't have to necessarily buy probiotic pills. Like I said, you could get them in yogurt. Sauerkraut is filled with probiotics. Kombucha, that's my personal favorite probiotic. Kefir as well. Anything that's fermented. So kimchi, for those of you that love Korean food as much as I do, that also has a probiotic. And even the mother, like the brown alien stuff at the bottom of the apple cider vinegar, that's a probiotic as well.
Huh. Interesting.
Yeah. And then to go back to diet, if you can't tell, that's my favorite natural remedy. If you can eat a plant-based diet with a lot of colorful vegetables that have a bunch of fiber, that fiber is kind of like food for those good bacteria to grow and help you out even more. So what I try to do is I try to eat plants as much as I can. Now I still enjoy a good cheeseburger every now and then, but again, it's plants, mostly vegetables, more than meat. And then I am always eating some kind of yogurt. That's like my ritual. Every night I'm finishing with yogurt, and I started making kombucha at home. So I get that probiotic in.
Nice. We're talking with Dr. Lance Braye, fourth year resident, Lawrence Family Medicine Residency. This week, we're talking about natural remedies. When we come back, we're going to get into some of the natural remedies. And we'll talk a little bit about one of my favorites coming up next. Welcome back to this edition of Pulse on Health. I'm your host, Mark LeMay. This week, we're talking about natural remedies with Dr. Lance Braye, fourth year resident at the Lawrence Family Medicine Residency. All right, let's start into some of the natural remedies. One of my favorite is the neti pot. I found out about this a couple of years ago when I was having some sinus issues, and it works like a charm. Takes a little bit of getting used to, though.
Yeah, so neti pots are great, but they do take getting used to. I always tell my patients I don't really recommend they do anything that I wouldn't do myself. So although I do not have allergies like that, I have tried the neti pot. And the way that it works is what it does. It's one stream of water that goes in one nostril. It flushes through your sinuses and it comes out the other. So yes, I will give you the heads up right now, people. You will be pushing water through one side and watching it drip out of your nose on the other. But when it does that, what it's doing is it's flushing out your sinuses. So it's removing any mucus, pollen, dust, anything that can be causing trouble or aggravating your allergies. But please make sure you follow the directions, because you have to lean a certain way or else all that water is going to go down your throat and you don't need to choke yourself. And you want to make sure that you either use distilled water, which is the cleanest water you can get, or you can boil your tap water, let it cool to room temperature, and throw a pinch of salt in there. Um, Because if you just flush your sinuses with tap water, everything that's in the pipes you are putting in your nose. So just think about that. But yeah, neti pots are great, and the company that makes them, they even have like little spray cans of the saline solution that you can spray in one nostril to pop out the other. So it's good stuff.
Yeah, it takes a little getting used to. We'll
A
just
lot of
we'll
it.
just leave it at that.
Yeah.
How about the benefits of apple cider vinegar?
Yeah, apple cider vinegar, or if you're one of the cool kids on the internet, ACV. So it's got many uses. I use it to cook with. My wife loves to drink it for the taste. I've honestly used it to clean my hair before. And it's also a great probiotic, like I was mentioning before. When you drink the mother, which for those of you who aren't familiar with apple cider vinegar, is the brown goopy stuff at the bottom of the bottle. And we need more studies to know for sure, but there might even be a chance it could lower blood sugar and help with losing weight. But of course, if you're going to use it to be the end all be all for your weight loss journey or your diabetes, please speak with your family doctor. And when you want to drink it, you don't necessarily want to drink it straight up unless you're just really into a tart flavor like that, like my wife is. But you can mix it with a little bit of water. But you do need to drink it quickly, because if you don't drink it quickly, when the acidic part of it sitting on your teeth can mess up the enamel of your teeth. So one way to get around that is just drink it with a straw. It'll go quickly straight to the back of your throat, over and done with.
I have a friend who swears by local honey when it comes to allergies, but it's also got other uses. Let's talk about some of the benefits.
Yeah. So disclaimer, I love honey. I cannot fully explain how much I love honey. Okay. It's in my family blood. My great grandfather was a beekeeper. I grew up down the road from a place that was like a petting zoo slash bee farm. So honey is great. It's also a great sweetener to use instead of refined white sugar. So every time I drink my coffee at home, I use honey for a sweetener instead of sugar. Although it is still pretty sweet. So if you have diabetes, you don't need to overdo it with the honey. It's just going to be better for you than the white sugar. I also put it in smoothies, yogurt, anything I want to sweeten at home. And studies have shown that it's better than cough medicines when you have a cold. And then honestly, for kids who are like 1 to 5 years old, if they have colds, you could just give them a bit of honey because it has antibacterial properties to it as well. And it's filled with antioxidants, which we always want to get more of. You can even use it to heal skin wounds. But the most important thing, if we're talking about honey, although I love it, you do not give honey to kids less than 1 years old, because sometimes it could cause them to be very sick. So don't take that chance. But once you pass that first birthday, honey it up, unless you have diabetes.
Melatonin is apparently good for helping with sleeping issues, but I've also heard it's good if you're suffering from jet lag.
Yeah. So melatonin actually not just for sleep, it can help with reflux, and I'll get to that in a little bit. But if you are having jet lag, so it's got to be pretty specific. It only helps with jet lag if you are going in an eastward direction across multiple time zones, up to 7 time zones. Okay. So if any of us are, let's say, catching a flight out of Boston to get to California, we're going westward, won't really help. But let's say we're catching a flight to London or somewhere in the Middle East and we're crossing the Atlantic Ocean, definitely you can take the melatonin. What you want to do is you want to take it in the evening before bed after you get to your destination. So, for example, if I caught a flight today in Boston and I flew to London, whenever I'm going to sleep that night in London, about let's say 1 to 2 hours before bed, take about 1 milligram of melatonin, and then do that for 5 days, and that should help with the jet lag. Now, for those of you who have melatonin at home, you might notice when you go to the stores, it usually comes like 5 milligrams, 10 milligram tablets. But some studies are showing probably less is better. So if you can just buy 5 or 3 milligram tablets and cut those in half, that could do the trick. Now, as far as when it comes to reflux, it's actually been shown to help with some symptoms of reflux. So if you're someone out there who's dealing with heartburn or GERD, acid reflux, any of the things you want to call it, indigestion, just again, try taking a little bit of melatonin. It might help out.
Let's move on to the aloe vera plant. Great for scrapes and cuts and even sunburns. I remember my mom using it on sunburns when I was a little kid.
Yeah, aloe vera is great. I've seen it used in my family. We've used it for different issues with the skin. My wife uses it when she wants to pamper herself and she makes a face mask. I've seen people use it for hair. It could also help with reflux as well. Studies have shown that if you take aloe vera juice or an aloe vera syrup, That can help with your reflux and indigestion and heartburn, just as well as famotidine or some of the other things that we use. And yeah, I could really go on and on about it. Skin, hair, your gut, it's good stuff. But you
And
do
I'm
want to be
talking from the
careful.
plant. I'm not talking from the lotion you can buy or whatever. I'm talking from the plant.
Yes, the plant. You can like get it at the store. It's the big spiky triangle looking thing. Take
Hmm.
it home, cut it up. You could scoop out the gel in the middle. That gel is kind of where the magic happens, and you can make so many different things with that. But you want to be careful, is because part of it is latex. And so if you use the wrong part of the plant, that could be toxic, or if I remember correct, sometimes even cause a lot of stomach upset. So definitely do your research before you go making your own concoctions. But if you do buy the aloe vera juice in the store, that could help with the indigestion part.
We got into spices a little bit earlier. We talked about turmeric. One of the natural remedies that have been around in the spice category for thousands of years is ginger.
Hmm. Yeah. And then, there's also garlic as well. I
I'm a big
love,
fan of garlic.
yeah. Oh, me too. Me too. Like it's actually kind of weird how much I love garlic, but anyways, um, good stuff. And they're good for you. So all of those things, basically the way you want to think about it is that they are anti-inflammatory. So anti-inflammatory, it might sound familiar. I know some of my patients, I've spoken to you about the anti-inflammatory diet, or when we think of anti-inflammation, we think of like Tylenol and Motrin and Advil. Yes, all the same thing. So when we say anti-inflammation, just to take it kind of to the not so natural part for a little bit, and we're taking Motrin, right? Like, let's say me and you go play basketball this afternoon, and we're both old guys, so our knees are hurting, so we need some Motrin. The problem that's going on is there's a lot of inflammation in our knees at that time. So when we take that Motrin or that ibuprofen, it's anti-inflammatory, so it calms down the inflammation, and we feel better. And there's other diseases that people deal with that have to do with inflammation, like heart disease, rheumatoid arthritis, Alzheimer's disease, and diabetes. Also, there's inflammation that plays a part of it. So when we're talking turmeric, ginger, and garlic, you can actually just eat those things, keep them in your diet, and that kind of has that natural anti-inflammation there. So for some people, honestly, if you're having significant pain, but you don't feel like taking an ibuprofen, try taking some turmeric and see if that helps. And if it doesn't help, then you can do the ibuprofen. And when it comes to cooking them, you just want to make sure that um, one, that you're cooking it to where it tastes good, because that's honestly the most important thing. But the other thing is that it does not lose its effectiveness when you cook it. So garlic it up and invite me over.
one one natural cure that isn't a plant. Having sex. Sex
Yeah.
has been shown to improve heart health, ease stress, and boost mental alertness. Am I correct, Doc?
Yeah, it has. So the way to think about, like, oh my goodness, okay, well, like, what's the magic behind it? Really, it's, when you think about it, sex is kind of a workout, right? So just as much as I want people to have, a very active lifestyle as far as running, lifting weights, dancing, whatever brings you joy, for those of you who have a partner, sex is also great too. So besides like the cardiovascular health, and just kind of that good stress that it puts on the body, also just some of the natural hormones and chemicals in your body that get released during sex, like oxytocin, which is kind of the attachment hormone. It's the same hormone that when a mom is breastfeeding her baby makes her and the baby bond more and more to where they can't be separated. And we know that it gets released during sex as well, which is why you probably realize you fall in love with your wife more and more each time. Um, but yeah, it's definitely something that's very helpful. Definitely the most natural thing we have, since none of us would be here without it.
One of the things I was surprised while doing research for the show was chicken soup. It
Yeah.
actually does ease symptoms of the common cold.
Yeah, it does. You're 100% right. Mama knows best.
That 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 surprised me. Out of all the research I did for the show, the chicken soup actually is good for you.
Yeah, so that's the thing that, I really, if the listeners or those watching the video for this out there can take anything away from this, is that the food you eat is a medicine as well. So chicken soup, especially if you can get like the good homemade, like mom chopped up a chicken, threw some carrots and onions and garlic, and use anti-inflammatory, colorful vegetables full of antioxidants into this, cooked it up for a couple hours, and then served it to you. That has a lot of natural things that are going to help you, right? So if we're going to think of food as medicine, the other thing I want to remind everyone, right, is like, if you come see me in the office and we're not doing natural remedies, but I'm prescribing you a pill or something like that, I'm always going to say, there's risk and benefits to everything that we do. And so if there's risk and benefits to the medicine that I can give you out of the pharmacy, that means there's risk and benefits to the foods that you can eat as well, right? So you got to really be thinking about what you put in your body. You wouldn't put Kool-Aid in your gas tank, right? So you don't need to put junk food all the time in your body. Now, if you want to enjoy some junk food here and there, that's fine. Honestly, I have an ungodly love for the cannolis down at Tripoli, but I cannot eat the Tripoli cannoli every day, or else we're going to have a bad time. But, every couple of weeks, every month or so, I'm like, I'm going to treat myself today. And I walk down to Tripoli and I get me a cannoli. But most of the time, I'm really just focused on trying to get good quality food in me, because I can't really help you guys be healthy if I'm not healthy myself.
That just proves that you're not just a doctor, you're also human.
I am also human. Yes.
Really quickly, we've got about 2 minutes to go. I'm going to toss out some common ailments. You get to come up with some natural cures. Ready?
Yeah.
Poison ivy.
Poison ivy. If I had poison ivy, I would go to Market Basket and grab a leaf of aloe.
Acne.
Acne. If I'm dealing with acne, aloe, again, I can make a face mask with that. I can also make like a mask with turmeric, because that anti-inflammatory nature is going to cut down on the inflammation of acne. And I can do a wash with apple cider vinegar.
Anxiety.
If I'm feeling very anxious, I'm probably going to sip some chamomile tea, or get a couple of essential oils, specifically lavender. That'll help with anxiety.
Arthritis.
Arthritis pain. Like we said before, if I've got arthritis and I don't necessarily want to reach for the Tylenol and the ibuprofen yet, I'm going to take a couple teaspoons of turmeric.
And muscle pain.
Muscle pain, I'm going to do the same thing. I'm going to take a couple teaspoons of turmeric. I'm going to do some stretches to really kind of stretch my muscles out. Maybe ask my wife if she could give me a massage. And then I will also drink water.
All right. Doc, I really appreciate you being on the show. It's been an education for me.
Yeah, I appreciate you having me here, and I'd love to do it again sometime.
Thanks, man. I'd like to thank Dr. Lance Braye for being our guest on this edition of Pulse on Health. Just a reminder, you can hear all of the podcasts via our website at glfhc.org. Just click on the link about halfway down the main page. Until next week, I'm Mark LeMay. Have a healthy week, everyone.